Fambulona adu, mina Dr. Frances Wuri, mina Dr. Fodembele Umandem and the Uman Siklem. Today we can talk about female infertility. We don't talk about the man infertility a while back. This is way woman not able to forget belle. We know so we day in a society also we put so much premium on childbearing, being pregnant, delivering a baby and child rearing. And it's very, very distressing for women that we're not able to get belle and we're not able to go through pregnancy successfully. We know say this is a physical thing, but definitely it causes a lot of psychological issues, depression. This is something we can make marriages then scatter, relationships then end as well. So in as much as obviously we don't talk about the male aspect of it, because it finally be like for say this society so mostly we can think say if a couple not able to get belle, it's mostly the woman's fault. Now we find out say it be very important for talk about the male aspect. So today we will talk about the female aspect. So you will get what we call primary infertility, mean to say ever get belle, and then secondary mean to say you don't get belle, you don't born before, but now you struggle for get that number 2 or number 3 as the case may be. So for like we say you infertile, it means to say you and this man for the dinner for the get regular. By that we mean 3 to 4 times a week. Now what do we mean by regular? Regular unprotected sex for a period of about 1 year, especially if you day below the age of 35. If you day above the age of 35, then that period now only for 6 months. So if you and this man don't dinner host together, una they meet 3-4 times a week, 1 year don't pass, you not get belle, you dey under 35, we go say okay, there's a problem here, this is not infertility. If you dey above 35, then we go say for a period of 6 months, una sure say una they meet 3-4 times a week, then we will consider say this na infertility. So the risks then boku as to why make woman go dey not able for get belle. One at the age. We want to be to say, all things being equal, we want to be to say people then they born before they're 35. Nowadays we'll go to 38. But the older you are, the truth is that the quality of the egg we produce is less. Man they able for make sperm. We from the time we day inside we your mama belly, that egg then day we don't get. Now the same egg we they go through throughout we lifespan, which means to say the older you are, the older the egg, and the higher the chance say the quality of the egg go be poor. So age now 1 for sure, and even obviously the number of, because every month you lost egg with your period. 2, your hormones. As again, the older you are, your hormones they can be in disarray. But even way for young people in certain conditions then like this polycystic ovarian syndrome, we can make the hormones they act the way how they're supposed to act. So it can find out difficult for like to say they can woman and they get belle. Weight also they add to your hormones derangement. So if you overweight or if you really dry, so now not feel like for saying for fat people then no more. If you really dry, then this stuff can affect how your hormones then they play. Now we can talk about people that really exercise but they self then can go months then they miss them period. We still let you exercise, but we not still let you overdo them. So if you exercise but you can go months, you miss your period, maybe you need it able for ovulate, you need it able for pull egg. Certain conditions then like the polycystic ovarian syndrome, like endometriosis, all can affect one how the egg come out, and possible way how the egg and the sperm they meet, and possible way how that when they don't meet on how then they able for implant. Woman the way they get repeated infection, that infection where you go smell something, you see something, you go take medicine in a corner, you not go to hospital, maybe you not treat them with the right antibiotic, maybe you they get them over and over because your partner said they need to treat. Repeated sexually transmitted infections also can cause blockage in the tube. It they make the tube then they get space for letting man in water able for go up and meet the egg, then this can lead to infertility. Substance abuse, whether not cigarette smoke, whether not recreational drug, whether not alcohol, all of them then they can also affect equality and obviously lead to infertility as well. Certain things and they can dey inside the womb we can affect if woman they get belly or not. We just don't do a video on fibroid, where if the fibroid in a place where they block out the sperm, they go up and block the man in water, you know, go able to get belly. Another kind growth they will then call a polyp, waking lidom, usually outside picking for lidom, outside the period they come out, then this can affect if you get belly or not. We don't talk about the hormonal issues, you reproductive, the hormones they really make you woman, as well as another hormone I also we then call a thyroid. There's a gland here where they produce a hormone. So until then if this need they work the way I suppose for work, it can make it difficult for you get belly. We don't talk about the tubes. If you tube them block, you not go able to get belly naturally as well. Stress, we know say sometimes if you dey under a lot of stress, it dey make your body not dey work the way it's supposed for work, then this self can affect how you dey get belly. Now I want to talk about D&C. If you're not a woman where they get repeated procedures na your uterus, repeated procedures na your womb, sometimes and day it can leave scarring na the side outside the picking supposed for lidom. So you the egg and the sperm go meet, but it not go get side for implants because all side not healthy inside the womb. If you don't deal with person over the 1 year or the 6 months, depending on your age, you see say it define and difficult to forget belly. It absolutely important that una kind of hospital. This na discussion first about your periods, una sexual history of infection, so many things that they will go discuss, not only for you but obviously for the man as well. Certain tests then they will go need, whether a scan will they send you for, whether once if you tube open or lock, whether na your hormones that we want check for you the woman, whether na the quality of your egg we want check, whether na the number of the egg we want check. All of them things that they go important, as well as the exam we go do for you, what you belly, what you private part, and the like. Based on their results and they depending on waiting the results say, then they go determine waiting at the diagnosis and how for help you. Now because I they concentrate by you the woman, we they assume say at this point all thing by you man okay, or if you man get issue in self day under medical advice. Now waiting important is those prevention things that we already talk about. You get for do your part and left the rest to God. Make sure say you need to smoke, make sure say you need to eat right, make sure say you take medications only as prescribed, make sure say you supplement as in your folic acid for ensure say your body day in hopefully in readiness for a pregnancy, a day at optimal. Make sure say you dey exercise as I say, make sure say you avoid stress at all levels if possible. Safe sex, because I can't overstress the importance of not having repeated sexually transmitted infections. So make sure say you practice safe sex, and if this now your partner, let it be like for say now 1-to-1 now we want certain things. Then the way we go find out it will probably need surgery, some na medication they need, some na weight loss they need, lifestyle changes, some na fertility awareness for let you know who say you actually they ovulate and know the right time for get sex. We get couples there where the man they applying, the woman they are, the man only they count for weekend. He asks for let it be like for certain people and they able for conceive without a proper timetable as to when them for me get the good term them for meet. Sometimes they not so just the normal things, we get for go extra, whether na IUI, whether na IVF, depend on waiting they happen between you and your man. So if people are out there, one of the most important things is ensuring say where a couple don't date together for a long time, we stop for they ask that question, who stay you they born? We never know how people then they suffer in silence. We never know what they happen at people in private life. You don't know how people then they look forward for let it be like for say then get that belly and either able to say there's a problem or God in time just not reach it. So let we be a bit more compassionate where we deal with infertility within we society. Till next time, me and Dr. Francis, we wish you all a happy and a healthy week ahead.